Hello, I want to first introduce myself. I am Nicholas Martinez, and today I will be talking about vitamin D supplementation. So, when we talk about vitamin D supplementing, I think it's best to break this down into two halves. The first being vitamin D. Vitamin D is a fat soluble vitamin that's found in foods. There's two main types. There's D2, also known as ergocalciferol, and D3, aka cholecalciferol. And then supplements. What is a supplement? Well, it's a product that contains ingredients needed to supplement the diet. So in this case, we're talking about supplementing the diet with vitamin D in an altered form. That's not just in foods. In forms you can see in the pictures I've provided at the bottom here. On the left-hand side is a common picture of vitamin D supplements, and on the right is a multitude of different supplements. So again, we're taking these altered forms of these nutrients and supplementing the diet. So when talking about the nutrient vitamin D and all nutrients in general, we want to make sure we understand what are the food sources of vitamin D. Vitamin D is a fat-soluble vitamin that's found in multiple foods, like trout, salmon, tuna, and mackerel. It is also a nutrient that is used to fortify other foods. And what I mean by fortify is that it is just a nutrient added to other foods. So vitamin D is added to oatmeal, it's added to milk, it's added to eggs, and that's now a fortified food. You can also get vitamin D through sunlight exposure. Sunlight exposure actually converts certain cells in the skin to the active form of vitamin D. And we can get the amount of vitamin D we need in a day with about 20 minutes of sunlight. Going into a little bit of the history of vitamin D, for centuries, deficiency was shown through bleeding gums, rickets, which is like kind of a bending of the bone, and muscle aches. In the early 19th century, they found that if you ate oranges and certain fruits, that these symptoms went away. But still, again, not really understanding what's going on, just knowing that eating fruit kind of took away these symptoms. A little bit later, a scientist named Edward Mellanby found that cod liver oil, which is very high in vitamin D, actually helped treat these symptoms of bleeding gums and muscle aches. And it wasn't until 1932 that a man by the name of Elmer McCullum actually gave vitamin D the supplement name we now know. So only less than 100 years have we actually labeled the supplement vitamin D as something we can take and actually help with our bodies. So now we'll get into the benefits of vitamin D supplementation, a few of the main reasons why it is found to be beneficial. First and foremost, bone health. Vitamin D coupled with calcium promotes bone growth, reducing the chance for fractures. On the right here, I provided a picture showing healthy bone. This is kind of a micro picture, like a really zoomed in picture of bone. On the left, you can see that it has holes that aren't very large, and this is healthy bone. On the right, we see another zoomed in picture of bone, and now we have these large kind of gaping holes showing that that bone has kind of broken down and it's now weak. It's now a little brittle, and that is what we don't want. Research has found that when you take vitamin D with calcium, it can actually promote bone growth so that we get back to this healthy bone we see on the left. Another one of the benefits of vitamin D supplementation is muscle function. That's our muscles contracting throughout the day. That's us picking up our phone. That's us getting groceries. Vitamin D can actually support the muscle fiber growth, which helps us with all those movements. It helps with getting out of bed. It helps with tying our shoes. It'll help with throwing a ball with our kids. Immune system. For anyone who doesn't know, when I say immune system, that is just our body's defense against bacteria, against disease, against illness. And we want to make sure that's always strong. One way we can actually do that is, again, through vitamin D supplementation. Low vitamin D levels, say we don't eat it from food sources for a while, say we don't take vitamin D in supplement form, say we don't get a lot of sunlight, we'll then get low levels of vitamin D. And that's been shown to weaken that immune system that we need to have to stay strong. And so by taking vitamin D supplementation, it can strengthen that immune system. And with a lot of different supplements, there's always claims surrounding them. But what we're worried about is the amount of evidence supporting it. So diabetes, weight loss, and depression have claims saying that if you take vitamin D, it'll help with those things. we have to remember that the evidence for those things, diabetes, weight loss, and depression, the evidence for that is very little. So for now, let's just try to take vitamin D for the 3 previous benefits I got into. So method of delivery, all this means is how the product is delivered. How are we taking in a vitamin D supplement? Well, you can take it in through a liquid form, a spray form, a chewable tablet, a dissolvable tablet, a pill taken with water, or in a liquid capsule. As you can see here, pictures on the bottom are just depicting things I mentioned. So you have the spray form, which is just a few sprays into the mouth, a liquid dropper form that again, you can drop a few drops into your mouth, the common supplement form here, and then a chewable tablet. So just depending on which one works best for you, you have a multitude of different options you can actually take to get vitamin D. So with all supplements, there are safety issues. We want to make sure we take the right amount in a day. In the case of vitamin D supplementation, we measure how much we consume in what is called an IU, or international unit. It's just a unit of measurement. It's like grams, like ounces, fluid ounces, but in this case, it's just called international units. There's a daily recommendation for vitamin D, and it differs based on an age range. So if you're between the ages of 19 and 50, about 600 IUs per day. If you're between the ages of 51 and 70, it's also 600. If you're over the age of 70, we're looking for about 800 IUs per day. In the supplement form, the average vitamin D supplement has about 1,000 IUs per serving. So it's always important to make sure we understand how much we're getting per serving to make sure we reach the recommended daily amount. So should I take vitamin D? Well, before taking any medication or supplement, always discuss with your primary physician first. It's always important to monitor any nutrient deficiencies when visiting your doctor's office. So if you're not exposed to sunlight, if you don't eat salmon and fish and fortified eggs, maybe it's a concern and maybe it's something you can bring up with your physician. Anytime you take supplements, we always want to keep in mind what medications we're taking, because certain supplements mixed with certain medications can have negative interactions, something like a stomach ache or diarrhea. So we want to be aware what supplement we're going to take and what medications we're already taking. With vitamin D, it can have negative interactions with the medications orlistat, statins, and thiazide diuretics. So again, always bring up your concerns with your physician and ask if this vitamin D supplement I'm going to take will interact with my medications. But overall, vitamin D is an important nutrient. It promotes calcium absorption, bone health, immune function, and muscle function. Again, it is a supplement, something that is just added to the diet. Should not just be the main source. We always want to make sure we're getting vitamin D through plenty of food like our eggs, our oatmeal, our fortified cereals. And to treat any deficiencies that may be severe, we can use supplementation. So overall, vitamin D supplements are a beneficial way to get vitamin D into our diet and to promote things like bone health, immune function, and muscle function. But overall, always bring these concerns up to your primary physician before taking.